took prednisone and she left the best treatment center in America. Why? Today, you can find out the real reason why she would leave the Cleveland Clinic when she was getting the best treatment she could possibly get for her autoimmune condition. Let's welcome back Ashley Spencer, who has a horrifyingly stunning, miraculous tale to tell us today. So Ashley, where are you and why are you there?
I am actually back in Cleveland, and I am here to explain why I had to return to Cleveland. For the past 2.5 years, I have been hiding a secret. I was actually raped by a Cleveland cop, and I was on trial this past week. The verdict came in, and he was found guilty because the DNA was found on my body. I left the Cleveland Clinic because I did not feel safe living here, knowing that he was a cop and he was out on bond the entire time. So I left the best treatment in America, where I was getting phenomenal treatment. My health was so improved, and now I have deteriorated so much being back home in Bristol, Pennsylvania, where I have doctors that don't believe me in Philadelphia, PA, and I get horrible treatment there. And yes,
she's actually in the hospital right now.
And I am in the hospital right now because I have a severe peanut allergy, which we talked about before, Megan and I. And when I was boarding the plane, my dad wiped down the seats and they were going to make a peanut allergy alert. But I feel that they need to make it before people board instead of when everyone's on the plane, and someone had already opened peanuts and mine is airborne. And I went into full anaphylactic shock again. And I used my EpiPen, and 2 doctors saw me. I was turning blue. So I was carried off the plane. 911 was called. I am in Southwest Hospital in Cleveland, the closest hospital they could get me to. I was tubed, intubated for 4 days. I just got off today. And then when I woke up, I was informed that I have COVID. My rapid test came back positive, and my PCR test came back positive. And which is ironic is I tested negative before I came to Cleveland. And in the courtroom, they did not allow me to wear a mask because they needed to see my facial expressions when I was testifying. And they had everybody in there without a mask on, which is absolutely ridiculous because of the extent of my autoimmune disease.
So you have to take medications that suppress your immune system.
Correct.
And you're in a public facility and they wouldn't let you wear a mask when Omicron is surging all across the country.
They gave me a face shield, but face shields do nothing. I need to be wearing the N95 mask at all times, as directed by my doctors, and they would not let me do that.
And you had to travel across the country for somebody else's trial, not your trial.
No.
And you're traveling home and you nearly died on the plane.
Correct.
And the reason you nearly died on the plane.
That happened.
That is terrible. So there's so many questions here.
Go ahead, ask away.
So, okay. Were you wearing a mask on the plane?
Correct. Yep, an N95.
You're wearing an N95 and you still had such a terrible allergy to the peanuts.
Yes.
Like it was through your mask.
Swollen through my mask that they almost couldn't get a tube in, and I almost needed a trach.
You were so swollen and turning blue that they couldn't even put the tube down your throat.
Yeah, they almost couldn't get the tube down, and I almost needed a trach.
And for anybody who doesn't know what a trach is, it's where they have to cut here to get, like, to bypass your throat to get to your lungs.
And I absolutely do not want that because I have common variable immune deficiency, and that would cause severe infections, and I wouldn't be able to take care of that.
Yeah, like you would never recover.
No, exactly.
Oh my gosh. Okay. All right. So we've talked about the fact that you got COVID because you were in a courtroom without a mask and no one else was wearing a mask to protect the autoimmune, immunosuppressed person.
Yes, because I take methotrexate, Nucala, and then I'm supposed to be on IVIG for this common variable immune deficiency. But right now they stopped that because they don't want me in infusion rooms that people are getting the monoclonal antibodies when they have COVID, which I understand. So that's putting me at more risk because I'm not getting my immunoglobulins.
And so one of your conditions that it's making it so your body just doesn't even make the immuno.
No, and evidently my boosters didn't work when they tested it. So I got them for no reason. But they did give me the monoclonal antibodies yesterday when I was intubated.
While you were under, they gave you monoclonal antibodies.
In case I would have had a reaction, I was still under.
And have you ever had COVID before?
No, I did not.
And so this is your first time having it. Now that it's Omicron and most of the monoclonal antibodies and other treatments don't even work.
Correct, from what I've heard. They said they gave me a special one for immunocompromised. I want to say they called it Cizendra. So it's specialized just for immune compromised people. So hopefully it works, but I think they said they'll check in a few days the antibody levels.
Oh my gosh. And so you're not currently on prednisone, but you've been on prednisone many times.
I'm on Salumedrol. My
Okay.
body doesn't process the prednisone. It doesn't. I had a pharmacokinetic study done and it doesn't pass through the liver correctly.
So you have it. So anybody who doesn't know what Salumedrol is, it's the injectable kind. So how often do you inject that?
They're giving it to me every 4 hours right now, 60 milligrams, because of how red I'm still am and how tight.
So she showed me her arm earlier. It's bright red.
Yeah. So yeah.
It's not just that her throat was closing off. It's her skin reactions.
And my legs and my face and my neck.
All turning red from this allergic reaction.
I get Benadryl every 6 hours by IV. And then they just started morphine because I have the real bad body aches from the COVID.
Oh my gosh.
That just started, and the really bad headache. And I don't like to take narcotics, but they said in this case, Tylenol wouldn't work.
Are you having any trouble breathing, like aside from the throat? Like, are your lungs?
Yeah, my lungs are very tight, they said. So I'm getting treatments every 4 hours, 2 to 4 hours.
Wow. So 2.5 years ago, a man in a position of authority did something terrible to you.
Yes.
And you had to leave the best care available for you.
I was
because you felt threatened.
Yes. And the other girl left too and moved. We both didn't feel safe there.
Yeah, because he had guns. He was a cop. And he was out. He was free and he could do whatever. You were afraid he could continue to perpetuate his crimes. Is that what you're feeling?
Correct.
And so that happened and you got the rape kit so that there was proof that it actually happened.
Yes, I had a scene kit done the next day. So there was DNA found on my body, which helped prove in the case. That's why he was found guilty in my case.
And so because of those, like that one action, and then the consequences of that, you were legally required to be in court.
Correct.
You couldn't not be in court.
No, they wouldn't let me do Zoom or anything. I had to be there.
And so you had to be there physically in person, even though it's the middle of a pandemic and you are immunosuppressed.
Correct. They did not care.
And were there any accommodations for the fact that you're immunosuppressed?
Nope. They didn't care.
They didn't care.
No.
And
the prosecutor tried fighting for a mask. The defense attorney said no.
And so the defense attorney, what did the judge say?
I'm not sure what the judge said, to be honest.
But so the attorney that was on your side was saying she needs to wear a mask. And then the other attorney said, no, we need to see her face.
Correct. Because they want to see my facial expressions.
And so you were wearing a face, like a clear shield?
Yeah, which does nothing.
Yeah, especially with Omicron being so contagious. And
exactly.
So you were forced to be put in a public location indoors with no accommodations.
He had everybody there, his whole family. There was no seats for my advocate. There was no seat for my private attorney. He had his whole family there.
And nobody tried to accommodate you in any way.
Mm-mm.
And you were forced to be in public in this enclosed indoor space with, I'm assuming, probably poor ventilation. And so and did you mention, by the way, that you had your negative test before? You did, right?
Yeah, the test on Monday, the day before I go out.
You had a negative test to get on the plane, to get there.
Yeah.
And then you get there and you're in this enclosed space with no accommodations. Correct. And somehow now you're testing positive.
Yep.
And you haven't even been able to leave Cleveland yet.
Nope.
Still there.
Yep. Still in the ICU.
Because you try to leave this like scene of horrible memories. And the minute you get on the plane, you have an anaphylactic reaction and you're still there.
Yep.
This is just the most terrible story, but
now it all makes sense.
But now it all makes sense.
I wanted to put it together for you so you know why I left.
That you have made so many sacrifices for this, like, one night. You sacrificed that amazing care you were receiving in that hospital, the Cleveland Clinic. And then you
had 14 doctors taking care of me. Wow. I was getting the most amazing treatment.
And now you're back in Cleveland, but you're not at the Cleveland Clinic.
No, but I'm getting excellent treatment where I'm at right now at Southwest.
Oh, good.
They're excellent.
Good. So you've made it this far. You've made so many sacrifices. You've been ventilated, intubated for days now, just trying to escape the crime. But there is one little piece of justice, and that is
I won.
Right?
Yes.
Tell us about what that's like.
I feel ecstatic because they were attacking me for my medical reasons, which was totally irrelevant. And I feel glad that I was told I was a credible source and that he got charged.
Yeah. Anybody can watch the news reports. It's Googleable. Just what should they put in the search results?
Cleveland cop rape.
Cleveland cop rape. And you can see exactly that she was found to be a credible witness, that no matter how they tried to twist her health history to make her seem like she was the one who wasn't credible, it actually turned out that he was the one who wasn't giving the credible witness, right?
Yes. And the judge said I was credible as well as the other girl, Lauren.
And so far, he's been convicted, but he hasn't been sentenced.
He gets sentenced February 28th.
February 28th. And the news report said it was like a potentially 3-year sentence of like being in jail.
Yep, 3-year jail sentence, 15 years sex offender, and then obviously he can't be a cop anymore and lose firearms.
And he loses firearms because firearms were involved in this altercation. Wow. Well, justice is served, even though you're still paying for it. Oh my gosh.
Yeah. But like I said, I won in the end. He lost.
Mm-hmm. And he's like, his attorney forced you to be exposed to COVID. So that's not good. Not good at all.
I told the prosecutor, so he'll tell him.
Yeah, I'll bet. So what would you say to other young women who are in the situation you were in that night?
My message to women is, please, if you're going to go on Tinder or use a dating site, meet in a public place.
She's in the hospital and it's like midnight. They're turning the lights off.
Yeah. Meet in a public place. Don't ever go back to a person's house that you don't know. My message is, if something happens to them, please don't be afraid to reach out. They will take you seriously, and go to the hospital and get a kit done. That's my message.
Yes.
To women. It's very important.
Yep. Because
don't be afraid.
Don't
yes,
be
you
afraid.
may feel embarrassed. I did, but they're so nice and they treat you with dignity and respect.
That is so good to hear. And the fact that you had that kit done was what allowed them to really do the full sentencing or full conviction. They haven't done the sentencing yet. And so without that, he could still be being a predator to other women. And so it was hard for you to go through that, but it's preventing who knows how much untold suffering to others, right?
Correct. And that was the whole point my dad said in the text messages. You don't know if he's going to do this to other people. You need to go to the authorities right away.
Yes, exactly.
And I felt bad that I included my dad in it, but it was my instant reaction.
Yeah, of course. I mean, I don't know why, like, your father should be involved. Like, he's your protector. He's the man of your life, right? Like,
yeah.
Of course you would include your father.
Yeah, I was scared. I didn't know what to do.
Yeah.
And he's like, nobody puts your hands on them. Call the police now and give them the facts and don't embellish. Mm-hmm. Those exact words.
Yep. Yeah. And because
and the 911 call, exactly what I told the prosecutor. It all matched.
It all matched. And now justice is served and he is off the streets, off the beat, unable to use his position of authority to intimidate or hurt women anymore.
Correct. So I feel like a sense of relief that he's now in a lot of trouble.
And now your secret is no longer having to be kept secret, and you can breathe a sigh of relief.
And now people can know why I'm not in Cleveland getting the proper treatment that I need.
Yeah. And hopefully other people who need to get the proper treatment they need can actually get it safely in Cleveland now too.
Correct.
So thank you for making that huge, sacrifice after sacrifice after sacrifice in order for this day to come.
Yes.
Well, Ashley, thank you for telling your tale. You could have kept it secret, and that would have, who knows what the consequences would have been. So thank you for that. And thank you for sharing your experience having an autoimmune condition of them all, all of them.
At least I can say the defense attorney couldn't.
Yeah, that's the funniest part is he couldn't even say them.
Nope.
Even though he was questioning your actual experience having had them. What were you saying about that?
He couldn't say it, so he needs a Hooked on Phonics book.
And then he was trying to accuse you of you personally
injecting the drill.
Injected capsule, the powder kind.
No, the nurse did that.
Yeah. And
I didn't make that up. And I was like, no, I didn't. Do you want to see the scars?
Oh my goodness. Wow. So that should be illegal for somebody to treat you that way, in court. That is just unbelievable.
That's why I was irrelevant. I kept mumbling under my breath.
Yes, this is completely irrelevant. It's not a medical exam, right?
No, not at all.
Oh my goodness. Okay, well, I appreciate you taking the time to tell this tale, to get justice served. And we all wish you best of health and healing to get finally recovered from this horror show that you've been through.
Yeah. I hope the COVID goes away sooner versus later.
Yeah. Yeah, seriously. We need you to continue to tell your tale with your own voice and not through a tube.
Yeah.
Because you have a story. There's a reason you have been revived for the third time now.
Yes.
Thank you, Ashley.
You're welcome. I appreciate you taking the time.
All right. Signing off is Dr. Megan, Prednisone Pharmacist. Bye, Ashley.
Bye.